President Trump was given a dose of remdesivir, the antiviral drug.
A promising potential treatment known as monoclonal antibodies.
The antibody cocktail REGEN-COV2 is still experimental.
The president's doctors also administered dexamethasone.
Generally speaking, we don't have an enormous number of treatment options right now, but there's certainly many things that are being looked into through clinical trials. Remdesivir, dexamethasone, and perhaps monoclonal antibodies are the most available at the moment for COVID-19 treatment. Most people will have relatively mild symptoms. They won't need to go to the hospital. And so they'll really just be treating their acute symptoms like fever and headache with Tylenol and with lots of fluids and lots of rest. That smaller proportion of people who go to the hospital might receive some intravenous, that is IV, through the vein medications like remdesivir, an antiviral medication. Another is this new therapy with monoclonal antibodies, which is a synthetic creation of antibodies that are given to a person who has COVID-19. And those antibodies will reduce the replication or the growth of the virus in the person and reduce their severity of illness. And then if people are really ill and having a lot of trouble keeping their oxygen levels up, dexamethasone, which is a steroid, is another therapy that patients will sometimes receive. It's important to realize that we don't have a drug or a treatment that will completely eradicate the virus. And so it's important that we keep up with all of the public health tools that we have to keep us safe. We can't let our guard down at this moment.